We have to decide in this country whether or not we want a financial hurdle to turn into a health hurdle when it comes to caring for yourself and your family. And we're getting better. We're making progress. But people have different abilities to pay for the care that they need. And if someone has a life-saving medication or a life-extending medication available to them and they can't afford it, we should not live with ourselves to allow people to walk out of that pharmacy without that medication. And we need to make those changes. We're a wealthy country. I believe we can afford that.
You can do that with a stroke of a pen. You can get rid of all co-insurance and co-payments for patients with cancer. But if you do that and you mandate that people have insurance coverage, everyone providing care in the cancer system will raise their prices. And so that will become a compoundingly more expensive thing to do. And that additional money flowing to cancer hospitals, to drug companies that make cancer drugs, won't give us more benefit. It will just make those entities richer. And so, like all changes to this dynamic system, you have to think about the consequences of doing something like that. Don't get me wrong. We should have a system where patients with a new diagnosis of cancer or a cancer recurrence don't have to worry more about their pocketbook than they worry about their health, their families, the possible consequences of them dying soon, and managing their illness. The system we have today relies on burdening them financially to hold down the prices of the care they receive. It doesn't work well. It bankrupts people, it drives them off of insurance, but that is our free market system as we have constructed it.
Just like anything in life, I think we wish that we can take a magic wand and get rid of all the costs that are related to anything related to healthcare. And I think that that's a beautiful aspiration, but we're far from that. And what I think that we really need is that we've got this amazing horizon of 21st century cures that are coming to the market. And what we really need is new ways of paying and financing for healthcare moving forward. And that's not going to be an easy task. And sometimes the science goes faster than what we're ready for in terms of a system that's ready to promote that access. But if we can get science to the right patient at the right time, I can't imagine that there isn't a win-win-win for all of us in that.
In a world where the out-of-pocket cost for patients in cancer is $0, that would be a great world for us all to be in. For things to happen that way and for the system to evolve in that manner, we're going to have to see more data and information given to the patient at the point of care so that they can choose the type of therapy and the type of care process that makes the most sense to them in their lives. The second thing you're really going to need to see is more opportunity for the provider and the patient to have some of that dialogue. Right now, there's just not enough time to have that conversation. And so having conversations about a person's ultimate kind of treatment goals, how it impacts their activities of daily living, how it impacts their ability to do things like work, play, and have fun and enjoy their lives becomes very, very important.
I think that the biggest hurdle for $0 is focus and clarity. The patients want one thing, the doctors and healthcare providers want one thing, the insurance companies want one thing, the pharmaceutical companies want one thing. So there's really no focus or clarity on what's best for the patient, what's truly best for the patient. So I think that everybody needs to get together and find a purpose, a group focus, and work together.
Well, I mean, the biggest hurdles, again, are the people are just used to doing the same thing all the time. For drug companies, it's, well, gee, if we go zero copay, who do we have to pay off to go zero copay? It's the wrong answer. PBMs are saying, well, we'll do zero copay if you pay us enough rebates. Wrong answer. The government, has to get its act together and say, if you give a drug away for free as part of a solution, we're not going to sue you in terms of lowballing the best price. It's just a lack of will. It really is a lack of will. And I mean, Buckminster Fuller, who was a mathematician, and once said, there's no point in fixing the existing model. It's too broken. It's time to build a better model. And I think that's what we need to do here, is build a better model based around this very simple idea that you should guarantee people an outcome based upon what you know and what you feel your product can do.
The biggest hurdle to having zero out of pocket for cancer costs is that we have to pay for everything. Where do we get our health insurance today? Well, about 50% of people get it from their employer. They have to pay for it. If the employer pays higher costs for health care, that's less money to go into someone's paycheck. About 25% of people get their health care from Medicaid. 15% get it from Medicare, which means taxpayers. If we zero out of pockets, it has to come from somewhere. Someone's going to have to pay that amount of money. I think we could redesign our system to do that. I don't know that we have the political will to reduce costs so that it's more like what people have in other countries, where they walk in the door, they show their insurance card, and they get care, and they walk out and they don't pay a penny. We would have to reform our tax system, reform our healthcare funding system. So I think we're a long way away. As much as I would like for that to happen, we're a long way away from that happening.